What motivates people to get cosmetic procedures? We're going to talk about that in this video. It's something I think is really important to dive into because, you know, you can't really open a social media app without being bombarded with ads for filler, Botox, different cosmetic procedures, change this, change that. Not to mention everybody out there is using filters. I have no problem with people using filters, but I do think it can impact how we think of ourselves, our self-esteem, and maybe perhaps serve as an underlying motivator for changing our appearance. I know a lot of you guys avoid TikTok, which kudos to you. I highly encourage staying off of that app as much as possible. I do think it is a bit of a brain drain. There is a heavy push on that app for plastic surgery. It's not just me, I've heard this from a lot of people. So we're constantly being reminded that there are a lot of cosmetic procedures out there. You've got Botox, fillers, lip flips, thread lifts. There are a lot of tweaks you can make to not just your face, but to your body. All sorts of body contouring procedures, radio frequency microneedling, liposuction, tummy tuck, mommy makeover. These things are all heavily talked about on social media. I don't think any age group is safe from the constant talk about cosmetic procedures. I think we have to be very careful though in not making assumptions about why it is that people seek cosmetic procedures. You might be of the mindset that people are just getting these because they're being influenced by these influencers, the Kardashians. People are just getting these because they have low self-esteem, but it's actually a lot more nuanced than that, and each person's individual reason for pursuing any given cosmetic treatment is highly individualized to them, so you really can't pass any kind of judgment on someone for getting a cosmetic procedure, nor should you. People are free to do what they want with their bodies, but of course, if you're going to put it on social media, people are going to have an opinion about it. Is it all about vanity? Why are people doing this? Well, one study actually sought to determine what it is that motivates people to do cosmetic procedures. 53.3% said they did it to prevent worsening of any existing condition or symptoms. You know, not all cosmetic procedures are solely vanity based. There are certain things that can happen to your skin that can be painful, like scars, for example. Not only may you be bothered by the way they appear, but they can itch, they can be uncomfortable, they can limit mobility. So that is certainly one reason why a lot of people pursue different cosmetic procedures. Psychosocial factors definitely were a huge motivator. 67.2% said they sought cosmetic procedures to either feel happier, have better self-confidence, or overall an improved quality of life. Some people view it like, I don't know, getting an ice cream cone after you won the soccer game. 61.3% saying, I just do it to treat myself, to celebrate something. Many people are actually motivated for professional reasons. 54.8% said they did it because of their job. And that may sound weird, but if you'll remember back to my video on how acne impacts women's self-esteem, I mentioned in that video that it's become clear that a lot of women feel like having acne or acne scars significantly hinders their professional development, and that either people view them as being juvenile because they have acne, or maybe it affects their self-confidence. I know in bodybuilding, a lot of women seek out breast augmentation simply because it's considered, you know, the standard, the norm to have breast augmentation as part of competing. So yeah, I mean, there's definitely reasons beyond just looking good. It may be filtering into wanting to be competitive in a certain area. Maybe they aren't necessarily unhappy with their breasts, but they feel like having breast augmentation would give them a competitive advantage. I think there is a strong misconception that a lot of people do cosmetic procedures because they are seeking approval from someone else. This study actually showed the opposite. Majority of people in this study reported that their motivations were internal. It wasn't as though they were receiving external pressure from a friend, a family member, a spouse. It was all internally motivated. And you know, this is one study. Studies, they're nice. They give us some information, an idea of what's going on, but they never capture all of reality. So bear that in mind whenever you're talking about studies, that it's gonna miss people, and this study is no exception to that. Cosmetic procedures that were more likely to be motivated by psychological or emotional reasons were body contouring, acne scar treatment, and tattoo removal. I mentioned scars, and a lot of people pursuing different cosmetic procedures to improve the look of a scar. It also can help improve the symptoms related to a scar. But there are other things that you might not realize can come with some uncomfortable symptoms. Some people have, for example, maybe lost a lot of weight and they have loose skin. And loose skin, nothing is going to get rid of that other than surgical removal. It's considered a cosmetic procedure, but in some cases, it may be almost medically necessary because that loose skin for some people, not everyone, can cause problems. Friction, skin irritation from the skin-on-skin contact, the skin in between the folds of loose skin can break down. It's more likely to then become colonized with Candida yeast, and that's very uncomfortable. It can be very painful. It's a miserable thing to have to deal with. So it makes sense that somebody, maybe they're not bothered by the appearance of the loose skin, but it's caused them symptoms, discomfort, a painful condition that they want to correct. Now, this one study I wanted to share with you guys, I think it's interesting. It actually sought to determine, does getting cosmetic procedures have any impact on baseline happiness? They looked at patients who you might consider frequent flyers of cosmetic procedures, meaning they get quite a few of them. 6 treatments a year, spaced throughout 4 different treatment visits. And the study basically sought to ask, are they happy at baseline? Are they happy after? Their baseline scores suggested that they are very happy, but interestingly, there was no difference in their treatment happiness compared to baseline. And it didn't matter what type of treatment they had, the number of treatments, the number of sites treated, or the aggressiveness of the treatment. They were all pretty much just as happy after the procedure as they were at baseline, suggesting that procedures did not impact their overall happiness. But it's important to note that this study was looking at people who are a bit seasoned in the realm of getting cosmetic procedures. They'd already been getting a lot of them. So it's possible that there is a ceiling effect, meaning you get procedures and they do make you happier, but only to a certain level. And that's kind of your new normal, and you feel that way, and getting more procedures doesn't impact that new baseline. These are just happy people to begin with, whether they have procedures or not. The procedures don't impact their happiness. It's hard to say. I think it's really important that we take a step back when it comes to placing judgment on people who do seek cosmetic procedures, because there is a lot of individual nuance that goes into someone's decision to pursue them. Of course, there are people out there who may be very vulnerable, who are chasing after procedures as a way to make them feel better, and they're never satisfied. This can get into a dark territory known as body dysmorphia, and no amount of cosmetic procedures will make the individual happy, and they're always perceiving things as being a problem on their body. And that is one path that can definitely occur in people, and that's something that plastic surgeons, cosmetic dermatologists need to be aggressive in terms of screening for, because it's certainly, it's not a good thing for either the patient or the provider to be chasing procedures that are, maybe just kind of going too far and not offering any sort of relief. There's something that really needs to be addressed there psychologically. But a lot of people pursue cosmetic treatments just because they want to and they can, and it makes them feel good, but they feel good to begin with. Their happiness is not dependent on getting them, but they like them, similar to how people change their hair color. Nobody is shamed for that. It's interesting watching on social media how people are viciously attacked and judged when they do get certain cosmetic procedures, assuming that the person is doing it because they want to, no one's pressuring them to do it, and they like it, they enjoy it, or maybe they're doing it because they've got a symptom related to that problem and they're hoping to alleviate that symptom. People will just leave the nastiest comments I see on people's posts who have had these procedures done. Oh, well, you don't even look the same anymore. So what? So what? Does that hurt anyone? No. We're not required to look exactly the same. Even if you don't agree with getting plastic surgery, that's your point of view. That's your choice. But other people are free to do with their bodies what they want. Let me know what you guys think about this, because it's definitely a slippery slope. I can see the side where people have their reservations with it and are wanting to discourage chasing procedures, because it definitely can go down the wrong path for sure. It definitely can go down the wrong path where somebody becomes hyperfixated and full-blown body dysmorphia, which is a psychiatric illness. And so I can totally understand the reservations people have there. Whereas on the other hand, I do think that a lot of people just enjoy changing things up about themselves, and they are, perfectly happy. It's not hurting them. It's not hurting other people. It's their money. It's how they choose to spend their time and how they want to look. That's something that they have bodily autonomy over. and it shouldn't be something that they should feel ashamed for choosing or try and hide. But I do not agree with the vicious attacking of people who have had cosmetic procedures and the assumptions as to the reasons why they have had them. I don't agree with that because, like I said, a lot of people, they may have underlying symptoms that are alleviated by these procedures, and I also don't agree with them because people are free to do what they want. It doesn't necessarily mean that they have some sort of emotional problem, and it's not up to you to critique their appearance. It's just rude and uncalled for and unnecessary. And it says more about you than it does them. Like, why are you so bothered by the fact that somebody got filler or Botox and have changed their appearance? It's such an insignificant, superficial thing to be angry about. It makes no sense. On the other side, I can see some questioning and wanting some transparency when it comes to people who are selling you something, and they're selling you something that they claim got them a certain result, whether it be to their body, their face, when in reality they're not disclosing that they did have cosmetic surgery, and that's why they look that way. So for example, I see this a lot on social media, people who are selling programs on how to grow a bigger butt, but they've had plastic surgery to their rear end, implants or, BBL or whatever, and they're not being forthcoming about that. It's fine if you've had those procedures and you tell your audience, hey, I've had these procedures, but I also do these exercises. These are the exercises. But if you had the procedures and you're showing like a before and after and using your before and after to sell your routine, you're not telling people the after is actually after surgery, that's not good. And I totally think it is reasonable for people to be asking those kinds of questions like, well, did you have a cosmetic procedure? That is totally valid in my opinion. But I don't think people who get cosmetic procedures are inherently fraudulent. It's no different in my mind than people who get their hair colored, than people who get permanent makeup, lash extension. I mean, where do you draw the line, I guess? Like, if you're gonna have a problem with somebody changing their physical appearance with, say, filler or Botox, then why are you not gonna have a problem with people doing eye makeup for hooded eyes? Why do you even care? Why do you care what somebody else does with their physical appearance? It really should not matter to you at all. I don't understand why it makes people so, I don't know if angry is the right word, resentful. For the most part, it's such an ad hominem attack against someone to come out and be like, oh, I can't stand her face full of filler. And it's like, really? You don't like somebody because of how they look? I mean, how superficial are you? What does the research tell us? The research tells us that people pursue cosmetic procedures for a variety of reasons. It's heavily nuanced. So making assumptions about people, you know what they say about assume, you make it out of you and me. Let me know in the comments what you all think. I'm eager to hear your opinions on this. I hope you guys enjoyed this video and that it was fun. If you liked it, give it a thumbs up, share it with your friends, and as always, don't forget, sunscreen and subscribe. I'll talk to you guys tomorrow. Bye.